Beyond doctors and nurses, there are crucial, often unseen healthcare workers who transform patients' lives and care. It's a world of intricate systems, complex emotions, tough decisions, and incredible human connection. My name is Anna. I'm a licensed clinical social worker, and I have been working in a hospital as a medical social worker for 2.5 years. Today, we're diving deep into the heart of medical social work, exploring the daily responsibilities, the challenges that can weigh heavy, and the rewards that make it all worthwhile. Starting with the main question, what do medical social workers do? In a short one-sentence answer, social workers in the healthcare setting address psychosocial barriers that affect a patient's hospitalization and continuity of care. What this looks like on a regular day varies based on the exact point of the healthcare system that a social worker is working within. But one of the main core responsibilities of a medical social worker is to psychosocially assess the patients that they serve. A psychosocial assessment looks at aspects of a patient's whole context of life, beyond just the illness or diagnosis that has brought them to the medical setting. This can mean assessing financial barriers, mental health, family support, coping mechanisms, access to basic resources like transportation, food, shelter, or even phone connectivity. Personally, I work in a children's hospital, which can look different than the adult setting because rather than psychosocially assessing the child, though I work primarily with the parents. So while completing a psychosocial assessment, whether it's a formal sit-down interview type assessment or just information gathered from multiple encounters, I take note of things like how a family's financial stress may affect their ability to continue the care that their child will need once they're out of the hospital, or how financial stress may affect the family's ability to be present physically in the hospital while their child is there, especially if that becomes an extended admission. Family support is huge as well. When a child is ill in the hospital, it is not just the child that is affected, it is their whole family system. Some families have family members who are able to take care of siblings while parents are with a child in the hospital. Some families have to prepare and lean on their support systems for a child returning home with much more care needs than they left home with. Assessing psychosocial factors not only informs how I work with a family and what I can do and the responsibilities that we'll get to in a second, but sometimes it can also inform the care that a child receives. What is reasonable to expect from a family when they discharge home? What will they have access to once they are home? Are these factors only relevant during a hospitalization, or will they continue into the outpatient world and need connection to resources there as well? Another main responsibility of medical social workers is crisis intervention. De-escalation and/or crisis intervention can be needed in a variety of different situations in a hospital. As a medical social worker, it is my job to address immediate trauma, grief, anxiety that families may be feeling. On some days, this could look like responding to a code called for an escalated parent, using de-escalation skills, partnering with the parent, listening to their concerns, de-escalating their big emotions, and supporting them as they work through whatever it is that brought them to that point of escalation. Crisis intervention can also look like sitting with families as they handle some of the worst days of their life, whether it's an unexpected bereavement or a thoughtful and loving decision to redirect the goal of care. On other days, crisis intervention can look like responding to non-accidental trauma that shows up to a hospital. In suspected cases of abuse or neglect, a social worker engages all of the proper authorities, whether that may be the police, child protection services, both, acting as a liaison between those in the hospital, and also acting as an advocate for the child while they are in the hospital. A large responsibility of mine as a medical social worker is resource advocacy. I get to connect patients to needed outside support. This can be insurance, this could be financial aid, this could be early intervention programs, this could be private foundations who look to serve families going through tough times. In some roles, medical social workers are also the ones that connect patients with home care and necessary medical equipment. In my particular role, I have case managers that do that instead of me, but that is a common role, especially in adult hospitals, where medical social workers will also be the ones working with home equipment companies, home nursing companies, completing prior authorizations for medications. I don't do that, but some medical social workers do. For example, a lot of patients that I work with are newborns, and for families who need it, I will go over everything that they may qualify for and help them get connected with those resources. If a baby is uninsured, I'll make sure parents know about Medicaid, WIC, SNAP. Most states have a state-funded early intervention program. In Georgia, it's called Babies Can't Wait. If they have Medicaid, I'll make sure a parent knows about Medicaid transportation that can get them to and from their appointments if they don't have their own personal transportation. I serve as a knowledge bank for a lot of the resources that are available for families, and then I connect families with what they need and what they may qualify for. This could also be connecting parents with outside mental health support if they need that through an extended hospitalization, connecting families with outside agencies that support medical costs once a child is outpatient from the hospital. I keep a finger on the pulse of what's available and when so that I can get the people who need it what they need. Lastly, though definitely not least importantly, a responsible of medical social workers is discharge planning. All of the previous things we've talked about so far go into discharge planning. Discharge planning starts the first day a patient is admitted. When I do a psychosocial assessment, it also helps inform discharge. When I'm intervening in crises, it also helps inform a discharge plan. When I'm connecting patients to resources, that's so that they can successfully discharge. In discharge planning, a medical social worker's role is to ensure a patient moves safely from the hospital to whatever their next step is. In the adult world, that might look like a short-term nursing facility, and that might look like identifying what options there are for facilities, giving agency to the patient to make a decision on which facility they're going to go to, calling the facility, seeing what bed availability there is. In my role with children, when they leave my unit, they may be going to another unit. In that case, discharge planning on my part is connecting with the social worker who will be taking them over and ensuring that any proper handoff is given so that they know how to support family as they continue their hospitalization. They may be discharging from the hospital home, in which I ensure that the resources that they need are set up and ready to go, or referrals are ready to get made when it's time to be making them. Sometimes more complex discharges from a child's standpoint may include going over with a parent when their follow-up appointments are, where they are, how they plan to get there, ensuring they understand a medication and a nutrition plan, and if they don't, circling back with the medical team, back with the nurses who teach parents, to ensure that both the child and their family are entirely set up for success to the best we possibly can before they discharge. Now, a bit tougher of a topic, but another way that a medical social worker ensures a patient moves safely to the next step is using that phrase as a euphemism in end-of-life cases. As a medical social worker, whenever there are ends of lives in the hospital, I act as acute support to family members until they can get connected with their true support system, and I help guide them as needed as they figure out the process of picking a funeral home, how that works once you have picked one, connecting them with foundations who can provide financial support in cases where that's applicable. If family has specific unique wishes, then working with other team members to ensure those can happen to the best of our abilities. A different form of discharge planning. If any of these responsibilities call to you more or less than other responsibilities, there is so much variation within the healthcare systems of where social workers work, and depending on where a specific social worker works within the medical system, you may be doing a lot of one of these things and not very much of another. You may be doing all four relatively equally. For example, if you work in an emergency department, you likely would be doing a lot of crisis intervention and then quick resource advocacy. If you work in an ICU, you're likely doing lots of psychosocial assessment, then crisis intervention. If you work in a unit that is working towards discharge, a step-down unit, you may be doing a lot of resource advocacy and discharge planning. If you work in an outpatient clinic setting, you likely will be doing mostly resource advocacy, some psychosocial assessment, crisis intervention only when needed, and no discharge planning because you're in a clinic. It is very cool to me how much variety there is, not only in the field of social work, but even within the field of medical social work. Next, let's get into the challenges of medical social work. The first challenge I want to talk to you about is navigating systemic barriers. All of the necessary resources that support the health of children that I connect family to relies on there being resources there for families to get connected to. For example, talking about insurance. Medicaid is a resource that helps ensure that children can have access to healthcare no matter the financial situation of their family. However, the financial requirements in order to qualify for Medicaid are absurd in Georgia. While completing a psychosocial assessment as a social worker, you may be able to identify lots of areas where support could be used and utilized well to best support a family and the health of a child, but that doesn't mean that there are things to fill those needs. Sometimes as a medical social worker, you hit dead end after dead end trying to help a family. I had a family experiencing homelessness who I helped reach out to all sorts of shelters, programs, assistance providers. Many of the responses that we got back were, "We're full, we don't have capacity to help." One resource even emailed me back 18 months later to let me know that now they had a bed available. Some financial costs that come with extended hospitalization. Some families have to drive 4 or 5 hours to get to the hospital, and if they're having to split time between home and the hospital due to a job or having multiple children, you can only imagine how high gas costs can get. Helping a family in that way relies on there being resources or people willing to help. So navigating systemic barriers is a big challenge in medical social work. It requires creativity, it requires advocacy, and it requires voting accordingly. Another challenge of medical social work is the emotional weight and secondary trauma that you may experience. I can say for sure that the months that I have spent in the intensive care setting, I have seen patients and families and stories and tragedies that weigh heavy on my heart. Something I personally do after having a really tough day is I ensure that I give my brain time to process the feelings, process the emotions, and then I find the line where I've successfully processed what I need to think about without ruminating on it, and I do things that recharge myself. Sometimes that may be going for a walk, sometimes that may be calling a friend or family member, sometimes it's watching a good show or reading a good book. For me, it's really helpful to acknowledge today was a really hard day, so I'm going to treat today like it was a hard day, while also understanding that I have to show back up and continue to be a great social worker for the rest of my patients. If you'd like to hear more discussion about burnout, I'll link a video up in the cards above where I talk about it more in depth. Sometimes the emotional weight of being a medical social worker comes in being a witness and a sounding board to families who are going through tough ethical or moral dilemmas, usually as they're deciding what their values are, what their best path forward is when it comes to a really sick patient. Things like that can weigh heavy. So I want to be honest about the challenges of being a social worker in the healthcare field. Another challenge that comes with being a medical social worker is that there is often a misunderstanding of the role. If you're watching this video, then I trust you to understand what a medical social worker is. But there are assumptions that come about social workers, whether it's families that are entering the hospital and have very valid reasons to mistrust a social worker, or it's other members of a medical team thinking that every social worker works for the state and child protective services. As a medical social worker, it's just very important to understand your role, what's within your scope and what's outside of your scope, so you can do your job and do it well and do it fully, while mitigating the expectations that sometimes may be incorrect of people who are not in your job. A common joke or a common meme that I see in the medical social worker world is about getting a consult from a doctor who promised an unhoused patient that you would find them an apartment. Fortunately, that's not realistic, but sometimes people's hopes are higher than resources that are truly available, which kind of goes into the misunderstanding of the role sometimes. So after all those challenges, you might be thinking, why would I do medical social work? Let's talk about the rewards that keep medical social workers doing what they do. Number one, the human connection. Working in healthcare, you see some of the most human moments. It is an incomparable feeling to help a patient feel seen and heard during their illness. It is an incomparable feeling to help a child's parent navigate this crazy journey and make it feel even just a little bit better. It is an honor to be a witness to many people's most vulnerable moments, and sometimes the worst days of their lives, coupled with some of the best days of their lives. In my particular role on my particular unit, I often get to know people for months and months and months and months, which means we kind of go through it together. I'm with them through highs and lows of their journey. And then, since I work inpatient, I get to send them on their way. Just today, I got pictures from a birthday party that a previous patient's mom sent me, who sometimes I sat with and we didn't know how many birthdays she would get. Getting to witness children's strength in that way, getting to sit with their families as they support them, and then knowing you made enough of an impact to be thought of to get sweet little cake cutting pictures a few years later is a hugely rewarding feeling. Another reward of being a medical social worker are times where you know you made a measurable impact. For example, talking about transportation again. Informing a parent of a resource, providing them information, walking them through how to use it, empowering them to use it as needed, and then getting to see that that child is making it to all of their outpatient appointments is a measurable impact. Getting to connect a family with a foundation that is able to help offset some of the financial devastation that they experienced during a hospitalization, and getting to see that family re-achieve stability because of that safety net that was given to them is a measurable impact. Getting to serve as a support and an advocate and an encouragement to newborns' families who would obviously so much rather be at home, but getting to make their experience just that much, maybe a little bit better by doing things like celebrating holidays, advocating for them to be able to be outside in the garden for the first time in their life, taking pictures, talking through sustainable coping strategies so that a parent can mentally make it through the hardest time that they've gone through. That's a measurable impact. Not only that, but being a medical social worker is rewarding professionally. My brain stays sharp. Every single day, I'm having to use so much critical thinking to be a mediator, a liaison, an information source, an advocate, a support, and a leader in the interdisciplinary team. So if you have heard all of this and you would like to be a medical social worker, where do you start? Your first step will be to get a degree in social work. There are both bachelor's and master's. It is pretty common to need a master's in order to be a medical social worker. After you get your degree, you will also want to prioritize getting a professional license. I have many videos about this process on my channel. If you are drawn to this career, you need to have empathy, initiative, and resilience. If this look into medical social work inspired you, be sure to subscribe for more insights into life as a social worker. Let me know in the comments what surprised you most about the field of medical social work. Thank you for watching, and I'll see you next time.